Hello, my name is Hannah and this is a presentation on pregnancy and health. So this slide is on potential risk factors for developing gestational diabetes. Gestational diabetes is also known as gestational diabetes mellitus. It occurs during pregnancy and individuals suffer from gestational diabetes have not suffered with diabetes prior to pregnancy. There are many risk factors which can affect the risk of developing gestational diabetes, and some of these factors include having parents or siblings with diabetes, having a BMI of 30 or above, having previously had a baby weighed over 10 pounds, and being diagnosed with gestational diabetes previously. There are some additional risk factors to the fetus as well, and some of these are hypoglycemia, which means the fetus's own blood sugar levels may have to be carefully monitored during birth and labour, and cutting the umbilical cord may alter the fetus's blood sugar levels. Another risk to the fetus is the fetus's shoulder becoming stuck during labour, because this may mean that more plans for the birth are considered, as well as sudden changes to the pregnant person's preferred birth plan. This is a slide on how gestational diabetes is diagnosed. So there are different processes that allow healthcare professionals to correctly diagnose gestational diabetes. A couple of these processes are the diagnostic process and the oral glucose tolerance test. So the diagnostic process happens during the first antenatal appointment, which is between 8 to 12 weeks. The healthcare practitioner will ask a series of questions and evaluate whether the pregnant person shows any potential risk factors at all. If some risk factors are identified, then a gestational diabetes screening test will be offered. Symptoms of gestational diabetes include headaches, UTI, fatigue, and thrush. These symptoms may be evidence of hypoglycemia, which can indicate gestational diabetes as well. Additionally, signs of gestational diabetes can be found through looking at a fetus. A larger size fetus may be indicative of gestational diabetes, but it's not always the case. Furthermore, elevated levels of glucose can cause the body to produce additional amniotic fluid around the fetus, which can result in premature labour as well. The oral glucose test is performed between 24 to 28 weeks. It normally happens in a clinic or a hospital setting and takes around 2 hours to complete. So before having the test, the pregnant person must fast 8 to 10 hours before. On the morning of the test, a blood test will be administered, and it will be taken to measure the patient's blood glucose levels before taking the drink. After this, the patient will be given a glucose drink and will have to drink it within 10 minutes and then wait 2 hours for a further blood test as well. The patient is still required to fast while having this test done. Finally, a final blood test will be taken, which will examine how the glucose has affected the body. After this has all been completed, then the pregnant person will be allowed to eat and drink as normal. This slide explains the appropriate care plan for someone with gestational diabetes. So if a pregnant person gets diagnosed with gestational diabetes, then a healthcare professional will provide them with the information and recommendations about antenatal care. The aim of treatment for gestational diabetes is to control the patient's blood sugar levels and try to keep them as normal as possible. It's always recommended for people with gestational diabetes to regularly test their blood sugar levels, and to do this, patients are given a glucose monitor which analyses the sugar levels for them. There are specific times when a healthcare professional might ask the patient to measure their blood sugar. These are 1 or 2 hours before or after meals, before meals, first thing in the morning, and randomised testing throughout the day. A healthcare professional may refer to a pregnant person to a dietitian, so it could help the patient with what to eat or drink and what could be the healthiest option. The glycemic index may also be introduced by the dietitian, and the glycemic index is a system that is used to measure the speed at which carbohydrates from what we consume are digested and raise glucose levels. The higher the GI level, the faster it will affect the glucose levels. So this slide is a continuation on the appropriate care plan for someone with diabetes. Depending on the results of the patient's blood glucose levels, a pregnant person may need to go on medication to help manage their sugar levels, and these medications include metformin and insulin injections. So metformin is a tablet and it's slow release and it helps lower the patient's blood sugar levels. This tablet has to be taken after or with a meal, and it doesn't produce insulin, so it would not affect the insulin production. Some side effects of metformin include lack of appetite, nausea, vomiting, and B12 deficiency, and also a metallic taste in the mouth. Insulin injections are delivered into the stomach through a needle because insulin cannot be taken orally. A pregnant person may be offered insulin injections if their blood sugar levels cannot be controlled by medication, like oral medication itself. As the pregnancy goes through the gestation weeks, then the insulin dose will also increase. This slide is an explanation on the factors that put a person at risk for developing preeclampsia. So preeclampsia is a serious medical condition which can affect pregnant people. It's diagnosed by high blood pressure and protein in the urine. It can affect pregnant people in the latter half of pregnancy, which means 20 weeks gestation or more. If a pregnant person develops 2 or more of these risk factors, then a significant risk of developing preeclampsia will happen. So some of these factors are being over 40 and having a BMI score of 35 or above, having a history of preeclampsia, and having had a premature birth before. If a pregnant person goes on to develop preeclampsia, then they will also be at risk of having a stroke, high blood pressure, and developing heart disease later on in life. Healthcare professionals will give the pregnant person information on how to lower the risk of these things happening, and this may include stopping smoking, making dietary changes, and prescribing low-dose aspirin. This slide explains the common and less common signs and symptoms for leading to a diagnosis of preeclampsia. So the most common symptom of preeclampsia are high blood pressure, pain below the ribs, protein in urine, and blurred vision. However, there are some cases where a pregnant person does not show any symptoms and the condition will be left untreated. This is why regular screening for preeclampsia is offered at every single antenatal appointment, meaning that the healthcare professional will measure their blood pressure at every antenatal appointment. The healthcare professional will take a pregnant person's blood pressure, and if it's elevated, then the professional might ask the pregnant person to provide a urine sample. The healthcare professional will look for any abnormalities in the pregnant person's urine, and this is done using a dipstick test. If there is protein in the urine, then the dipstick will change colour to confirm this. Some of the less common symptoms when diagnosing preeclampsia are increased creatine levels, liver dysfunction, pain, and a small gestational age. An abnormal ultrasound and a Doppler scan result as well. When a pregnant person goes into an antenatal appointment, the size and the weight of fetus is measured. If the fetus is smaller or lighter in weight than expected at the stage of gestation, it could mean preeclampsia. Preeclampsia can limit the amount of nutrients and oxygen a fetus gets, meaning that they could be smaller, and this is called small for gestational age. This slide is a description of the care plan and monitoring and caring for a pregnant person with preeclampsia. So when a person is diagnosed with preeclampsia, a healthcare professional will recommend different treatment plans depending on the individual. Depending on the severity and the complications of the preeclampsia, then the pregnant person will carefully select the right method of treatment for the individual. There are 2 different approaches of treating preeclampsia, and these are the watch and wait approach and medication. So the watch and wait approach are when a pregnant person's blood pressure comes back at an appropriate range, meaning that the healthcare professional does not need to have necessary medical intervention just yet. This will include outpatient appointments and a regular weekly blood pressure checks and urine sample. So the aim of this approach is to make sure the pregnant person's blood pressure stays in check, and if further medical intervention is needed. On analysing the patient's blood pressure, it may result in any other symptoms, and they may need different forms of medication. which will help assist with the preeclampsia symptoms. Each of the medications prescribed aim to achieve the same goal, which is to really reduce the blood pressure levels to a normal level. Different medications will be given based on the individual's needs, and this could mean allergies, intolerances, or side effects due to the medication, or even just a personal preference for the specific medication. After birth, more monitoring will be needed to see if there's any symptoms 6 to 8 weeks after postpartum preeclampsia, and this causes high blood pressure and again protein in the urine. So this slide is an the explanation of eclampsia and the potential issues it could occur if preeclampsia isn't managed. If preeclampsia is left without being treated, it could become extremely dangerous to the pregnant person and the fetus. It could be dangerous for the fetus as complications include lack of food and oxygen and restricted growth and limited nutrition as well. It could be dangerous for the pregnant person as complications include damage to the organs of the body, cardiovascular disease, and after-birth bleeding. Eclampsia are seizures that happen in individuals who are diagnosed with preeclampsia, and eclampsia can develop from preeclampsia due to the extra pressure placed on the blood vessels as well. In this case, that means it causes the brain to swell, and which that triggers the seizures of the eclampsia. Warning signs of the epileptic fit will include headache, inability to urinate, facial twitching, blurred vision, and dizziness. Eclampsia can be diagnosed after the pregnant person has had their first seizure. The risk factors which increase the likelihood of developing eclampsia include being under 17 or over 35 years old, having a BMI of 30 or above, having a first pregnancy, and having diabetes, kidney disease, or an autoimmune disease. The main treatment for eclampsia involves inducing labour and delivering the fetus if the pregnant person is healthy and stable. Medication may be given to keep the seizures under control as well, but most individuals are expected to recover from eclampsia after labour and delivery. On the other hand, some patients may carry their symptoms 6 to 8 weeks postnatally, and this will be followed up with a healthcare professional. So this slide explains the risks to the health of the pregnant person and the fetus after consuming alcohol during pregnancy. So it is recommended to pregnant individuals to seriously reduce or to cease all alcohol consumption while pregnant. This is due to the potential effects on the growth and development of the fetus, as well as long-term complications as well. The use of alcohol during pregnancy can increase the risk of premature labour and fetal alcohol spectrum disorder, small for gestational age, and a miscarriage is stillbirth. So the fetal alcohol spectrum syndrome is a neurodevelopment issue caused by the exposure to alcohol during pregnancy. As the fetus cannot process the toxins of the alcohol in their own body, the alcohol will circulate the fetus's bloodstream and could cause severe complications. Alcohol can affect the lung capacity, breathing, and also their brain development as well. So FASD, which stands for fetal alcohol spectrum syndrome, can involve motor skill issues, emotional regulation, impulse control difficulty, and delayed speech and communication problems. So small gestational age is a condition that affects the growth of the fetus during pregnancy. It's normally identified when a fetus does not measure to the expected growth measurements in line with the week's gestation of the mother. Low birth weight is noticed when a baby is born under 2,500 grams, which is 5 pounds and 10 ounces. There are several reasons why a baby might be born with a low birth weight. Some of these could be nutritional complications, smoking while pregnant, and substance and alcohol misuse as well. If mothers do suffer with alcohol withdrawal symptoms, then they can also consult with a healthcare professional as well. So this slide explains the impact of illegal substance usage during pregnancy on a baby after birth. So there is no form of illegal or recreational drugs which can be taken without harming the fetus or the pregnant person's health. So this includes cannabis, heroin, and ecstasy. So using any substance while pregnant could mean premature birth, an underweight delivery, and a miscarriage or stillbirth. Under certain circumstances, the utilisation of drugs will always come with side effects that can transfer to the fetus. Once the fetus is born and the umbilical cord is cut, the baby will experience withdrawal symptoms from the exposure to drugs that the mother has ingested. This is known as neonatal abstinence syndrome. So the symptom of neonatal abstinence syndrome includes sneezing, irritability, increased muscle tone, high-pitched crying, and lack of weight gain. If a baby is experiencing and showing any signs of neonatal abstinence syndrome, they must be moved to a neonatal unit for further examination, and this could include also giving the baby medication as well. Thank you.